So hello friends, this is our next video in antiepileptic drugs part. So this is our second video probably. In this we will discuss about carbamazepine. Okay. So mechanism of action we have discussed in our previous video, that is it causes sodium channel prolongation in its inactive state. Okay, carbamazepine just prolong sodium channel prolongation in its inactive state, and because of this only one mechanism of action. So this is example of narrow spectrum antiepileptic drug. Okay. Now what are the basic indications for this drug? So the first indication is epilepsy. Okay, and this is the first line drug for focal epilepsy. So this is very important MCQ question, which is the first line drug for focal epilepsy. So carbamazepine is the first line drug for your focal epilepsy. It can also be used in treatment of general seizure, and it rarely precipitate absence seizure. Okay, so avoided in cases of absence seizure. Now you can give it through oral or IV route. Oral route is for maintenance treatment of epilepsy, and in case of any emergency such as coma, you can give through IV route. Now the second indication after epilepsy is neuralgia, because it causes the prolongation of the inactive state of sodium channel, so it will decrease the activity of sensory pain pathway. Okay, so it can be used for the neuralgia. Clear? And that may be neuropathy, post-herpetic neuralgia. Okay, and the drug of choice for neuralgia, this is carbamazepine is the drug of choice for trigeminal neuralgia. In the case of trigeminal neuralgia, this carbamazepine will be the drug of choice. So this is another important MC question. Okay, the third is your bipolar disorder. Okay, so it can be used for the treatment of mania, and it is given in patient having mild to moderate cases because it has less efficiency in the treatment of mania. Okay, so these three are the general indications for epilepsy, and the first line drug for focal epilepsy, then your neuralgia, drug of choice for trigeminal neuralgia, and then your bipolar disorders. Now pharmacokinetics route you can give through both oral or IV route. It is lipid soluble, so it can cross blood-brain barrier. It is involved in liver metabolism by the enzyme CYP3A4. It also induces liver enzymes. Okay, liver enzyme inducer property it has. CYP450 induces. So it and one important MC question, that it also induces its own metabolism. So it is known as autoinducer. So multiple choice question is asked, which of the following is autoinducer? You have to take the answer carbamazepine. Carbamazepine is an example of autoinducers. If you increase the dose, it will increase its metabolism, so risk of therapeutic failure is more because of this autoinducer property. It also increases metabolism of sodium valproate. It has less teratogenicity. Okay, and it has also narrow therapeutic index, so therapeutic monitoring is done for this drug. Now what are the side effects? So you can use these mnemonics: less CAS, so L for liver toxicity, E for enzyme inducer, S for sedation, that is the most common side effect, sedation, then S for SIADH. Okay, the next one is your C for cerebral toxicity, and cerebral toxicity will lead to ataxia, nystagmus, and diplopia. Then the next side effect is A for agranulocytosis. Okay, there will be suppression of bone marrow. Clear? This carbamazepine metabolized by liver and form epoxy metabolite, and that epoxy metabolite causes the suppression of bone marrow. This is the side effect. Okay, so L for liver toxicity, E for enzyme inducer, S for sedation, S for SIDH, C for your cerebral toxicity, A for your agranulocytosis. Okay, now next is your SLE-like symptom, S for SLE-like symptoms. Okay, so these drugs are avoided in your liver failure. Okay, so now this S for SLE-like symptoms, that is rare, and last is H for hypersensitivity reaction. Okay, and in this there is genetic variation. If person is HLA 1502, okay, 1502 allele positive, that will lead to hypersensitivity reaction with carbamazepine. Clear? Okay, and this is known as Stevens-Johnson syndrome. Okay, those which have HLA-B 1502 gene that causes hypersensitivity reaction is also seen with the phenytoin drug. Clear? Now what are the drugs coming under this? So carbamazepine, this is original carbamazepine, and modified forms are oxcarbamazepine and eslicarbamazepine. Okay, and this carbamazepine we will differentiate these three drugs on the basis of this 5 point: metabolism, autoinducer property, drug interaction, bone marrow suppression, and SIDH. Okay, so for carbamazepine all are positive. For oxcarbamazepine this is negative, that is autoinducer. Oxcarbamazepine has not this property. Okay, but eslicarbamazepine is negative for all this. It has no autoinducer properties, it has no drug interaction, it has no bone marrow suppression seen, it has no SIDS property. Okay, and its metabolism is exclusive like kidney. So eslicarbamazepine is metabolized exclusively by kidney, whereas carbamazepine knocks carbamazepine by liver. Okay, so this is about your carbamazepine. So thank you.